Empowered Nurses, it's Lorie Brown, and welcome to today's video on COVID-19 Survival Guide for Nurses and Healthcare Practitioners. And I'm really excited today to have our special guest, Rosemarie Yetman. And Rosemarie is a registered nurse in the emergency room in Ground Zero in New York City. So talk about being in the middle of it all. She's amazing. And I'm so excited that you get to hear her story today because she is going to talk about 6 different ways that you can protect yourself if you're a new nurse or if you're being floated to an unfamiliar area. In fact, Rosemarie was in an unfamiliar area. She was in the emergency room with a patient, and nobody knew her there. She was brand new because she had floated, and she spoke up and actually saved a man's life. So I'll let Rosemarie share the story, but welcome, Rosemarie. Thank you for being here.
Thank you for having me here. I appreciate that.
So yeah, this man in the emergency room.
Yes. So this man, he was triaged, and he only spoke Korean. He didn't speak much English, and he just had a slight belly pain. And it seemed a bit odd to the triage nurse, but it wasn't very concerning at the time that he was very sick, but still he was taken to the trauma room. And like you stated, I was pretty brand new in the ED, and this man started to decompensate a bit, and the family that came with him was extremely worried. They were scared. They didn't know what was going on, and we needed to act fairly fast. So we kept saying to the family, don't worry, it's gonna be okay, just have a seat right here, we need to work on him, we'll come talk to you after, things of that nature. Yeah. So he started to decompensate really quick, where we had to give him tons and tons of blood product through a rapid infuser, and we had to whisk him to the OR. Except that day it was a holiday and there was no OR staff, so it was me, ER nurse, turning into OR nurse. I was a med-surg nurse turning into ER nurse, turning now into OR nurse.
Okay.
Yeah, exactly. And I just went with that patient. I was just following that patient. And so we went upstairs to the OR because he had a bleed and we needed to, stop the bleed. And while he was on the OR table, he coded, and we had to do our best to resuscitate him. And I can tell you, it was a makeshift team virtually. I don't know these guys, they don't know me, but we came together because we're going to apply our skills the best way we can to help save this patient's life. And so during CPR, we tried everything we can think of. We went through all our H's and T's, and the head of the code stated that, is there anyone objecting to calling the code, and pronouncing. And then I just had a flashback really of, that patient's family, his wife, his kids, and just the look of fear, and they had no power to, help the situation. And they really depended on us as healthcare providers to really, do what we do best. And that flashed through my head. And while the doctor stated, there's any objections to pronouncing, and I stated to them, mind you, it probably was a little bit more than 15 minutes, but I said to them, which one of you are going to go tell that man's family that you did CPR for 15 minutes? And I looked across and I looked at all of them, and they again were silent. So I shocked the patient. I am so proud to state that. And I told them, I said, stop compressions, because a leader of a code can change at any minute, right? It's just like navigating a boat. Sometimes it's the people in the boiler that knows what's going on best. Sometimes it's the people that's turning the ship and looking out for the iceberg. Who knows? Any given moment, it can change. And but the message behind that, we did CPR for 2 more rounds, And that man regained a heartbeat. He regained a stable rhythm. He went into ROSC. His family had another opportunity to see him. He had another opportunity to see his family, at least feel their presence, you know, and that meant everything to me.
Yeah.
You know, that meant everything to me.
But you're never too new to speak up. I mean, that must have been really hard for you.
Actually, it was out of passion. It was out of passion. And I didn't think twice. I didn't think twice about speaking up. And that's the message too. Yeah, either you speak up when you feel something is right, you speak up when you feel something is wrong. Okay? You speak up, um, and that should always be your guiding light, your moral compass. You know,
Yeah.
you cannot go wrong if you follow your moral compass.
Right. Very true. So for all you new nurses, brand new, haven't even taken the board, um, you're in your last year of school, and now you're being put into the workplace. Or for those of you who get moved to a faster paced area than you're used to, Rosemarie's come up with some tips for you. The first one is to do your homework. So what do you mean by do your homework?
Yes, so those who are joining a new area, and or traveling from, you know, afar to come and help out with COVID relief and efforts on the front line, try to get as much information that you can get, and ask yourself questions that you want to have answered, before you sign up. But it's important to understand that you can ask questions along the way. Like, you don't have to say, okay, well, I didn't have the chance to ask enough questions on what the environment I'm going into might look like or feel like for me. And now that's out the window. That's out the window. Like, I already signed up and that's it. No, like, you can always ask questions as long as it goes. You can ask questions come up because you might not always have the right questions to ask. But once you start being in the midst of it, right? Like, then certain questions must come to mind and you can ask those questions. There's nothing wrong with that.
And make sure you have a proper orientation, because and if you want to extend it, you've got to ask. You've got to stand in your power and ask, because your license is too important and these people's lives are too important. You don't feel ready to take patients on your own, you've got to say something.
Yes, absolutely. And during COVID time, so like, I'm not too sure, like, you could tell me better about how legal nursing concerns fall into play during this era of crisis. But I always remind myself is that you can always get another job, right? Your license is something that it's very hard to get another license.
Yeah, that's my favorite saying. You can always get another job, but you can't get another license. And we don't know what the boards are going to do. If people are getting in trouble during this time, we don't know. Um, so let's not find out. um, and the next point you had was being clear-minded. And what did you mean by being clear-minded?
When I say be clear-minded, right, is that you should be able to accept the situation for what it is. You're going to have moral conflicts, right? Like, my duty to my patients versus, my duty to be a caregiver, or an income bringer, or just my duty as a nurse, right? And
We're going to be getting into more and more ethical issues, like who gets a ventilator, or should we code patients when they're COVID positive. So a lot of ethical questions.
yes, there's going to be tons of ethical questions. And what I mean by be clear-minded is to determine you're going to have tough decisions to make always. That's the truth and reality of the situation. But when you're deciding on those tough decisions, you got to have something that you rely on in helping you make those decisions.
Yeah.
Whether it's like I at the end of the day, my integrity is what guides me to make those nitty gritty decisions, which are tough. It might be your integrity, it might be, my kids, it, and either reason, those are admirable reasons.
Yeah.
And you
You've
feel
got to be
guilt.
clear-minded to think. If you can't think your way through the problem, you're going to be um, acting on adrenaline, and you may not make the best decisions that way.
Absolutely. And don't feel guilty. Don't feel guilty for your choices. Just try to your best to have a clear process in determining what decisions you make.
Yeah.
But once you decide on a core reason for making your decisions, do not feel guilty for the decisions you make. You are human and you are a good person no matter what.
Yeah. And that was another point you made, is don't judge yourself, because you're new, you're thrown into this environment, you're helping, we really appreciate it and need it. But if don't judge yourself. Don't, I wish I would have gone back and did this. You can play the I wish I would have game all you want, but you're new, you're helping out. Don't judge yourself. You're doing the best that you can. And as long as you can look yourself in the mirror and say, I know I did the best I can, that's what matters.
Yes.
And I said clear making decisions from adrenaline, but I also meant making decisions from emotions, because you may not make the best decisions from emotions.
Mm-hmm.
Uh, and the next thing you mentioned is know your knowledge base. So,
Yes. Yes. So knowing your knowledge base, I think, is extremely important. You might be thrown into a different area that where you're accustomed to, right? I have a friend who's a psych nurse she told me yesterday that she's in the ICU. I said, what? You know? I said, what? I don't know what if the ICU change, it's like, the security level or anything like that, but I said, wow, like those are polar opposites there, you know, and I can just only imagine the type of unsettledness someone might feel. But knowing your knowledge base means that know what you are comfortable doing and knowing what you're not comfortable doing, and not feeling that you are inadequate because you don't feel comfortable with a certain task. And an example is, say, if you're requested to start, a life-saving medication through, an IV drip or something, or putting a patient on pacer pads and you're not really comfortable with doing that or something like that, you know, recognize that, and do not like, it's not a time to, to convert that to thinking pride and experience and stuff like that. It's not that moment. Like this is for one, safety, right? Two, for your own growth as well. And you need to, hey, other nurse that's been here. Like I don't feel uh completely comfortable starting this trip by myself. Can you just walk me through the process, or help me out with it? you know um I don't want to, I don't want to mess it up. And that's I love people who feel like that, because that's a strength like none other. That's a strength like none other you know So know your knowledge base. Like, it's not about what you do know, really. It's about, honing in on what you don't know.
yeah. And remember, you're still responsible. So if you don't know a medication or how to do something, don't take it on yourself. You've got to ask and get help. And even if your help is delayed, go up the chain of command if you have to get things done timely. But if you don't do it, you don't know it, and you don't do it properly, you are responsible. So don't let the basics go out the window.
Yeah. And just to piggyback off of that, like, I know it's one thing to say it and it's another thing to be in it. And I only talk from what I have a saying, like, I can only tell from what I've seen, right?
Right.
And I know that asking for help sometimes is difficult. I know that on not just from you, right? Like, it's difficult for other people to deliver you help, right? Or
Right.
you're always going to come back with, oh, this nurse, oh, doesn't know what she's doing, or oh, like, I gotta help somebody, like, that's annoying and stuff like that. That's their problem if they view it like that. That's not your problem, because at the end of the day, if something was to go wrong, like Lorie states, you will be responsible. And the next thing someone's going to say, well, they didn't tell me, they didn't say to me. So you should always, if you have to go up your chain of line, definitely, but don't feel any type of way if you ask someone for help and they don't want to give you help. Move on to the next person. Don't internalize that. That's not for you to take on.
Right. The goal right now is to take care of these patients, not, you know, but you've got to deal with your feelings, but there's a time and a place to do that after your shift. And so Rosemarie has some great suggestions on that as well.
Yes, so what's the next one?
That's take care, express your feelings.
Awesome. Awesome. So yes, expressing your feelings, absolutely, absolutely, because you're not going to be able to move forward in your work. You're not going to be able to focus on what's important if you don't express yourself. Whether you express yourself, at work with colleagues, or home with your, family or loved ones, or on the phone with a fellow, a family member, a cousin, a neighbor, or someone who don't even know you. There's
Yeah.
community coming out everywhere for mental, health, stress reduction, and anxiety relief, man, for real. Like, you need an outlet. You need an outlet. And sometimes, just talking to someone on these Facebook groups, right? Where you have a Facebook group, and finding someone that you don't even know, and just say, hey, like, you mind talking about, like, our experiences together on the front line, and comparing those experiences. It is therapeutic.
Yes. And again, remember, don't violate HIPAA, because the same rules apply. You know, you still can get in trouble for like not wasting medications properly, even if there is nobody to waste with. Um, holding medication in your pocket or pre-filling medication, all of that is still a problem. So, again, just because this is a time that's busier and crazier than normal, the rules don't go out the window. And so please, I know HIPAA is going to be a big issue after this is done, because your friends, your neighbors, people you love are in the hospital and you want to know about them, but you can't look at their chart. Even though, you're a nurse and you're there, you cannot look at their chart. They're not your patient. So remember, all the basics still stand, but you're just in a tougher, more emotional time. And so find somebody to talk to who you don't know, who you can express your feelings. I love that you did that, Rosemarie. And then just remember, don't violate HIPAA.
Absolutely.
Yeah. Any other tips that you can think of for a new nurse, or somebody who's coming to, like your psych nurse friend who's in ICU now? I can't even imagine.
I know. So for those that are entering the field early, the reality of the situation, orientation might not be the way it's supposed to be, or should, or was in the past. Um, but I want you to feel empowered. You don't have to be meek or timid. You don't. Like, we need you, right? We need you. That means you have a say. Okay. And the same thing that goes out to my traveler who's coming up to New York for assignments. I appreciate all of you, because let me tell you, like, travelers, your wealth of experience is second to none. And And I know that travelers also get bad experiences a lot of times in hospitals that they go to. They feel like they get the cases, the worst of the worst cases and things like that. And you know, I say to you too, it's time you must you know, speak up. You know, if you feel like an assignment is um very tough, right? Or like just unfair or anything like that, like it's time for you to take on that and embrace it by telling others like, hey, like, you know, what does your assignment look like? You know, like, do you think that this assignment is just a little too heavy? Like, how about we tag team? Right? Like I'll help you, you can help me with this or that. Like find a comrade, you know, find a comrade, you know, it's important. You cannot take on your shift without having some level of support with your staff, with others. You cannot. I don't care if it's another nurse. I don't care if it's a tech, a nursing assistant. I don't care if it's the nurse manager. I don't care if it's the unit secretary. I don't care if it's a physician. I don't care. It doesn't matter who. It matters why you do it, and you need to do it. You need to do it because you need to survive, and you need to be safe, and you need to be able to do your job in the best way you can.
So I would recommend, even if you are having travelers come or new nurses come, please welcome them with open arms. They're doing you a favor, and I know sometimes people don't treat travelers as well, but please, we're all in this boat together, and the only way we're going to get through it is together, working with each other and being there for each other.
Mm-hmm. Absolutely. Absolutely.
So thank you so much, Rosemarie. I really appreciate your input. And uh, to those listening, we love you. We thank you. We are so grateful for you for being on the front lines, and you too, Rosemarie. And that uh, we are you guys are the heroes in this story. I love this meme. It's all these superheroes. And then a nurse standing out, and it says, "Welcome to the club," because you are the true superheroes. So if you're enjoying this series, please share it if other people can get benefit from it. It's empowerednurses.org/COVID. And stay safe and keep doing the great job that you're doing. We love you. Bye, everyone.
Bye.